non-steroidal anti-inflammatory drugs. Primarily, from the name, in which group of drug it is primarily used as a analgesic. What are the different types of analgesic? There are two main types. One is opioid group of drug and another one is non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs used in the pain of peripheral organ. That means muscle pain. If there is a osteoarthritis, rheumatoid arthritis, so skeletal muscle, musculoskeletal system pain is relieved better by the non-steroidal anti-inflammatory drug. Whereas in the opioid drugs commonly used in the visceral pain. Visceral pain commonly one of the visceral pain. Name one of the visceral pain where opioid use. Any visceral pain where opioid used commonly? Yes, morphine used in myocardial infarction. If there is heart attack, myocardial infarction is a example of visceral pain where we use morphine, that is opioid drugs. Similarly, in osteoarthritis, rheumatoid arthritis, there is an involvement of joints and musculoskeletal system. In this situation, we use which type of analgesic? Non-steroidal anti-inflammatory drugs. Now, why it is non-steroidal? Why it is important to have this name non-steroidal? Because steroid is also an anti-inflammatory drug. So, these drugs, though they act against the inflammation, so it is an anti-inflammatory drug, but it is not a steroidal origin. There is no chemically, structurally resemble with the steroid. So, this name is non-steroidal anti-inflammatory drug used in musculoskeletal system pain as an analgesic. It has a anti-inflammatory property, whereas other group of analgesics are opioid analgesic used in visceral pain like myocardial infarction. So, non-steroidal anti-inflammatory drug, they use primarily inhibiting the prostaglandin synthesis. Prostaglandin is one of the important mediator for the inflammatory mediator. By inhibiting this prostaglandin, this non-steroidal anti-inflammatory. So, why it is named as a non-steroidal? Because both steroid and NSAID acts by inhibiting the inflammation. Primarily, they act by inhibiting the inflammation. But non-steroidal anti-inflammatory structurally doesn't resemble with the steroid, but their action is similar. Act by inhibiting the inflammation. So, they primarily used in a situation where there is a musculoskeletal system, where there is a inflammatory pain associated with inflammation. Pain associated with inflammation, these drugs used. So, important thing, it is anti-inflammatory. Their structure is different. Their structure is different from steroid. So, non-steroidal. Where it is used? Musculoskeletal pain. Example is musculoskeletal pain. Example: osteoarthritis, rheumatoid arthritis. They also very good in pain associated with inflammation. Example of pain associated with inflammation: inflammatory joint disease. Inflammatory joint diseases like example is gout. Very good. In this case also these drugs are very helpful. So, up to this it is clear where it is used: musculoskeletal pain, specially associated with inflammation, structurally different from steroid. So, it is called non-steroidal anti-inflammatory drug. Their primary action by inhibiting prostaglandin in inflammatory site, synthesis of prostaglandin. Commonly this is the classification. You have to remember the prototype drug is aspirin. Prototype drug is aspirin. Other drugs like ibuprofen, flumiprophen, mefenamic acids, these are the non-steroidal and where it is used. Aspirin commonly used in a 3 doses. Aspirin commonly used in 3 doses. In the lowest dose, it acts as an antiplatelet. Dose is not 75, 40 to 325 or 40 to 350, a dose range. Now up to 2 gram there is a analgesic as well as antipyretic. 2 to above the 6 gram it acts as a anti-inflammatory. Very good. So example of a use of anti-inflammatory dose of aspirin, where it is used in a anti-inflammatory dose. In which clinical situation? Aspirin as a anti-inflammatory dose. In which clinical situation? Rheumatic fever. You have to remember this name, rheumatic fever. It is different from rheumatoid arthritis. Rheumatoid arthritis, the dose is moderate dose, around 2 gram. In the lowest dose, it is antiplatelet. In the highest dose, it is anti-inflammatory. Anti-inflammatory example is rheumatic fever. Rheumatic fever, which organ is involved primarily? Rheumatic fever, heart. It is primarily affects manifests as a pancarditis. Pancarditis means inflammation of endocardium, myocardium, pericardium. So there is a inflammation. In this situation, which group of patient commonly affected by the rheumatic fever? Children. Children are more affected, more attacked by this rheumatic fever, and there the drug of choice is aspirin. Dose is more than 6 gram. That means it is the inflammatory example of inflammatory use of aspirin in inflammatory dose is rheumatic fever. In rheumatoid arthritis, dose is in the moderate dose. As an antiplatelet, it is 50 to 325 or 350. Where it is used? In angina, in myocardial infarction, to prevent further infarction. Clear? So aspirin, where ibuprofen, naproxen used commonly, ibuprofen, naproxen, musculoskeletal system. That means osteoarthritis, rheumatoid arthritis, there is a fracture, soft tissue injury, tendon injury, these drugs are commonly used. Mefenamic acid used in dysmenorrhea, pain during the menstrual cycle. Commonly used mefenamic acid. Ketorolac is used in specially as a eye drop. You have to remember these 3 or 4 special use. Aspirin in 3 dose, ibuprofen, flumiprophen, indomethacin, these are most commonly as a musculoskeletal injury, gout, inflammatory joint diseases like and osteoarthritis, rheumatoid arthritis. In case of as a eye drop, ketorolac used as a inflammatory used as a eye drop in case of pain in eye as an anti-inflammatory drug, topical uses. Whereas mefenamic acid used in dysmenorrhea. Now another thing is that preferential COX-2 inhibitor, selective COX-2 inhibitor. So there is 2 COX. COX means cyclooxygenase. You have to remember these 2 preferential COX-2 inhibitor like nimesulide, diclofenac, aceclofenac, whereas selective COX-2 inhibitor, all these are used in musculoskeletal injuries and osteoarthritis, rheumatoid arthritis group of, and there is another analgesic antipyretic with poor anti-inflammatory component, and this group is Paracetamol is the most important. Paracetamol or acetaminophen is they have very good analgesic as well as antipyretic effect. Analgesics means they relieve pain. কোন কি টাইপের পেন? Musculoskeletal pain, inflammatory musculoskeletal pain, and it is very good for as a antipyretic used in a fever, but they have very poor anti-inflammatory properties compared to other NSAIDs. Example is paracetamol. So there is a prototype drug is aspirin, then NSAIDs, then there is a other NSAIDs, then there is a COX-2 inhibitor, preferential COX-2 inhibitor, and there is a analgesic antipyretic with poor anti-inflammatory action. Example is paracetamol. And COXIBs are the selective COX-2 inhibitor. Clear? Cyclooxygenase, there are two primary cyclooxygenase, COX-1 and COX-2. COX-1 present as a constitutive. So it is present in the normal physiology, in the gastric mucosa, in the renal system. Whereas COX-1, COX-2 present in the inflammation, in the site of inflammation. So our action of drug, if they inhibit both COX-1 and COX-2, therapeutic use is commonly due to the inhibition of COX-2, whereas inhibition of COX-1 resulting into the side effect or adverse effect. Clear? So COX-2 came in the picture where they doesn't have interfere with the constitutive COX-1. COX means cyclooxygenase. It is an enzyme. Clear? So COX-2 came, or preferential COX-2 developed. Why it is important to have COX-2 rather than non-specific NSAID? This is the explain why. Because COX-1 is constitutive enzyme. By inhibiting COX-1, there is a different adverse effect. Like কি adverse effect হতে পারে? Peptic ulcer, there may be water retention, renal damage when it is used in prolonged time. By using COX-2, কখন আমরা prolonged time NSAID খেতে হবে? When we use NSAID for long duration, for months or years, কোথায় ইউজ হয় সাধারণত? NSAID কমনলি ইউজ কি হয় এখনো পর্যন্ত যা বলেছি? হ্যাঁ, কোথায়? Rheumatoid arthritis or osteoarthritis. Here the use of this drug for months or years, so they can produce peptic ulcer or renal damage in this situation. If it is used for 15 days or 30 days and stop it, then the adverse event is rare. But when it is used regularly for long prolonged period, in case of osteoarthritis or rheumatoid arthritis, there may be the adverse event by involving this inhibition of COX-1, resulting into peptic ulcer or renal damages. From the phospholipid, there is a arachidonic acid, and then there is a COX, that means cyclooxygenase and lipoxygenase. Lipoxygenase, leukotriene produce leukotriene, whereas COX, there is COX-1 and COX-2. COX-1 is, from the COX-1 there is a production of PGE2, I2 and thromboxinase A2. E2 and I2, there is a helpful for GI protection. Platelet function is involved, thromboxinase A2 and PGI2. And renal function is also regulated by PGI2 primarily. Whereas inflammatory response produce cyclooxygenase 2, COX-2. Here PGE2, I2 and thromboxygenase, they produce inflammation, pain and fever. So NSAID, the therapeutic action is due to inhibition of which type of cyclooxygenase? Cyclooxygenase 2, COX-2. Whereas if they inhibit COX-1, normal function of GI tract, stomach, they can produce peptic ulcer. In renal, they can produce renal damages. Now, one explain how aspirin acts as a antiplatelet drug. How? They inhibit COX-1 as well as COX-2. Now, in the platelet, it is COX-1, and they, by inhibiting, they also inhibit both PGI2 and thromboxynase. PGI2 is present both in endothelium as well as platelet, and they inhibit platelet aggregation. Whereas thromboxynase A2 only produced from the platelet. There is no release of thromboxynase from the endothelium. Now, next point is that endothelium has a nucleus, but platelet does have a nucleus. They doesn't have a nucleus. So, when aspirin irreversibly bind with the COX, the production of thromboxynase A2 from the platelet, it requires next generation of platelet to release in the blood. Whereas endothelium, they can, as they have the nucleus, they can produce PGI2 for itself. So, the balance between PGI2 and thromboxynase A2, which one is getting the upper hand? PGI2. And now PGI2 has a anti-aggregatory effect, whereas thromboxynase A2 has a aggregatory effect. Aggregatory effect means there is a clot formation, help of clot formation. That means in low dose, it helpful to release PGI2 by inhibition of thromboxynase A2. The balance goes in favor of PGI2. That's why there is a anti-aggregatory effect of platelet in low dose of aspirin. Clear? কি এক হচ্ছে PGI2 তৈরি হচ্ছে এন্ডোথেলিয়াম থেকে, থ্রম্বোক্সিনেজ এন্ডোথেলিয়াম থেকে তৈরি হচ্ছে না। এন্ডোথেলিয়ামে নিউক্লিয়াস আছে, প্লেটলেটে there is no nucleus. So 3 নম্বর পয়েন্ট হচ্ছে aspirin irreversibly bind non-selectively with the COX. So for production of thromboxynase A2, it requires next generation of platelet that take a prolonged time if we compare it with the synthesis of cyclooxygenase through the PGI2. PGI2 synthesis is much more easier because there is a nucleus in the endothelium. Clear? Explain why. Why low dose aspirin acts as a antiplatelet drug, or low dose aspirin in myocardial infarction or unstable angina or myocardial infarction prophylaxis. Why? Why there is a antiplatelet action? প্রথম কথাটা 3-4টে জিনিস মনে রাখতে হবে। একটা হচ্ছে লো ডোজের মাপটা দিতে হবে, এন্ড তারপরে এই পয়েন্ট PGI2 PGI2 অ্যান্টি অ্যাগ্রিগেটরি, thromboxynase A2 aggregatory. Thromboxynase A2 synthesized from the platelet who doesn't have a nucleus. It is primarily from the endothelium. It has a nucleus. And aspirin is a irreversibly, non-selectively inhibit COX. So production of the thromboxynase through the COX through the platelet, it requires new generation of platelet. Whereas in the endothelium, as they have the nucleus, they can produce next generation of PGI2 through the nucleus and it takes lesser time. So balance goes in favor of PGI2. That means non-aggregation of the platelet. Non-aggregation of platelet is helpful in both in myocardial infarction as well as prophylaxis and follow-up, and in unstable angina, stable angina also. Clear এই পর্যন্ত? COX-1 is constitutive, whereas primarily COX-2 is a inducible. কি দিয়ে induce হয়? Inflammation, and they lead to pain, redness and fever. Aspirin irreversibly they block COX-1 and COX-2. This is important to turn over recovery of aspirin action, most notable in the platelet, already discussed. Because platelet doesn't have a nucleus, it requires new set of platelet to synthesize thromboxinase A2 when there is a presence of aspirin, after exposure to the aspirin. Selective, why we preferred cyclooxygenase 2 inhibitors? Because the therapeutic action of non-steroidal anti-inflammatory drugs primarily through the cyclooxygenase 2, because cyclooxygenase 2 is inducible in inflammatory condition. By inhibiting that, it preferred, because then there is the side effect of cyclooxygenase. By blocking the cyclooxygenase 1, example are, what are the side effects? Peptic ulcer and renal damage. Primarily, you have to remember at least these two: peptic ulcer and renal damage. So selective COX-2 inhibitor and non-selective, they have similar effect as a analgesic, antipyretic and anti-inflammatory. Which NSAID has poor anti-inflammatory effect? Paracetamol, very good. So analgesic, antipyretic and anti-inflammatory. If we compare non-selective NSAID with COX-2 inhibitor, they are similar, but effect is different in case of antiplatelet aggregatory, antiplatelet action and gastric mucosal action, as well as aspirin sensitive asthma is less in case of selective COX-2 inhibitors. Then anti-inflammatory action, analgesic action and antipyretic action is the first three important action of NSAID: anti-inflammatory, antipyretic and analgesic. Where we can use anti-inflammatory action of aspirin, rheumatic fever which involve heart as a pancarditis. This anti-inflammatory effect is less in acetaminophen or paracetamol. Analgesic effect reduced in certain types of inflammatory pain. Antipyretic lowering the body temperature when there is a raised in case of fever, but it cannot reduce the temperature when it is normal. It is only reset the temperature when there is a fever. Fetal cardiovascular system, they can block the PDA. What is PDA? Ductal arteriosus can be blocked by indomethacin. Specifically drug, remember the name, indomethacin, in case of PDA closure. Cardiac protection by aspirin. Explanation how it can helpful in cardio protection as a antiplatelet. মনে আছে তো কি কি কেউ বলবে? E2, PGE2, I2 এইগুলো মনে রাখতে হবে so balance towards the PGI2 who has the non-aggregatory antiplatelet action is there clear তাহলে use as a anti-inflammatory example is myocardial কি rheumatic fever আর কোন এক্সাম্পল আছে anti-inflammatory inflammatory joint diseases like আরো ইম্পর্টেন্ট gout ঠিক আছে inflammation antipyretic in fever analgesic in osteoarthritis rheumatoid arthritis as well as in case of musculoskeletal injuries soft tissue injury or fracture then cardiovascular protection as low dose aspirin indomethacin to block this PDA persistent patent ductus arteriosus কোনটা বাদ গেছে ডিসমেনোরিয়া কোন ড্রাগ ইউজ হয় ডিসমেনোরিয়া mefenamic acid used in dysmenorrhea PDA তে indomethacin systemic mastocytosis এ ইউজ হয় niacin intolerability and Better's disease in this situation also this NSAID is used Better's disease niacin intolerance and mastocytosis adverse event NSAID gastrointestinal difficulties like abdominal pain nausea diarrhea most important একটা বলতে হলে সেটা বলতে হবে কি gastric erosion or peptic ulcer leading to peptic ulcer that can lead to hemorrhage also in which situation that can be occurred when there is use of NSAID for longer duration especially non-specific COX inhibitors or other than this COX-2 inhibitor for prolonged period কোন clinical situation এ prolonged period rheumatoid arthritis osteoarthritis for prolonged period then antiplatelet it inhibit platelet activation so that can lead to bruise also because what happened most of this patient where we used aspirin in low dose as an antiplatelet drug they have a either angina or myocardial infarction in this situation also we use other drugs like heparin or warfarin they are blood thinner they can lead to hematoma very easily so in this situation if the dose is of warfarin or heparin is not adjusted or there is a little trauma there may be lead to the bruise or increased chances of hemorrhage clear renal sodium and water retention that can lead to hypertension also or they can prevent the action of antihypertensive drug clear due to sodium water retention especially in case of edema worsening the renal functions in case of cardiac or renal already or cirrhotic patient cirrhosis patient in this case because it acts just reverse to the diuretics in this situation diuretics ki kore sodium and water excretion kore here this NSAID they are retain the sodium and water clear so it can first they can lead to edema they can worsening this renal failure in case of either cardiac hepatic or renal damage clear তাদের worsening করে if the patient is on antihypertensive whose mechanism of action is primarily by excreting sodium and water like example is diuretics ACE inhibitor ARBs they can impair their action So dose adjustment is required. At least you have to remember, if NSAID given in any patient, it should be short in duration, as short as possible. Clear? Not the dose, but the duration is much more effective for this side effect or adverse event. Cardiovascular, closure of ductus arteriosus. Now, if the pregnant patient is exposed to this NSAID, what happen? There is also there may be lead to closure of this PDA. Now, PDA is very important for fetal circulation. Clear? So, it only given if there is a persistent ductus arteriosus after delivery, it is helpful. But if the patient is exposed and there is a adequate amount of drug present in the fetal circulation, that can also lead to closure of the ductus arteriosus, which is not a very good effect in the fetus also. In case of stroke, thrombosis and myocardial infarction, they have a very dicey situation. They are depending upon the dose of this drug as a antiplatelet drug and use of the other anticoagulant drugs. But commonly in our situation nowadays, they used antiplatelet aspirin in case of unstable angina, in case of myocardial infarction, as well as in case of ischemic stroke also. But in case of hemorrhagic stroke, we shouldn't give aspirin. Clear? So, before giving aspirin to a stroke patient, you have to have this report of MRI report or CT scan report saying that there is no hemorrhage. But clear? Headache, vertigo, dizziness, especially in case of aspirin overdose, they can cause salicylism. There is a dizziness, hyperventilation, confusion is there. In case of high dose of aspirin, that name is salicylism. In uterus, they can prolong the labor as well as by inhibiting the labor pain, prolong the gestation by inhibiting the labor pain. Hypersensitivity like vasomotor rhinitis, angioneuritic edema, asthma, especially associated with aspirin. Aspirin induced asthma, urticaria. There may be shock and hypotension also. Now aspirin আমরা কি বলেছি, কি মনে রাখতে হবে? নন স্পেসিফিক, ইরিভার্সিবল, তিনটে ডোজ, কি ডোজ? লো ডোজ, অ্যান্টিপ্লেটলেট, মডারেট ডোজ, অ্যানালজেসিক, অ্যান্টিপাইরেটিক, highest dose, inflammatory. Use is rheumatic fever. Now, use of aspirin, because it has a very good anti-inflammatory effect. Though aspirin is not preferred in gout, because depending upon the concentration, they inhibit the excretion of this. কি কারণে হয় gout? Uric acid. Excretion is altered depending upon the doses of aspirin. So another is, though aspirin has a very good anti-inflammatory effect, their action on excretion of uric acid is different in different concentration. So it is not consistent. They can precipitate also. So the aspirin is not, though it is a very good anti-inflammatory drug, it is not used in gout. Explain why. Why aspirin is not used in gout, though it has a very good analgesic, antipyretic and anti-inflammatory effect. Primarily used analgesic, এই তিনটে সব সময় লাগবে প্যারাসিটামল ছাড়া, কি analgesic, antipyretic and anti-inflammatory. Used in anti-inflammatory টা হচ্ছে rheumatic fever, aspirin এর ক্ষেত্রে, rheumatoid arthritis, osteoarthritis, moderate dose. Then platelet aggregation, low dose aspirin. Adverse effect already discussed, কি হবে, peptic ulcer and sodium water retention. And for aspirin there is a synchronism also, a salicylism that lead to dizziness, and there is a vestibular dysfunction. How can it prevent? We prevent it by decreasing absorption. কি দিয়ে করবে? চারকোল, oral charcoal. Next, increase excretion by alkalinization of the urine, because it is acidic. So in alkali medium it will be excreted more rapidly. And supportive measures like fluid, decrease temperature by এক্ষেত্রে কি দিয়ে করবে? Paracetamol, bicarbonate for electrolyte balance, and if there is a other sodium potassium disbalance, and if there is a requirement of glucose, we have to give glucose. তাহলে তিনটে, একটা হচ্ছে decrease absorption when patient came early, then increase excretion by alkalinization of the urine, and third is supportive treatment. There is a fluid, there is a sodium potassium replacement, there sodium bicarbonate replacement, controlling of the temperature, as well as giving some glucose. This is the treatment of aspirin toxicity or salicylism. ঠিক আছে? Then another thing is that in case of children, if we give aspirin in case of fever, that can lead to Ray's syndrome. So why aspirin is not given in the children? Aspirin is a very good drug for fever, but nowadays it is not used. Nowadays means for 20 years it is not used as a first line drug. First line drug is paracetamol for the fever, not aspirin. Why? Because especially in the viral fever they can lead to Ray's syndrome in children. Ray's syndrome. So it is contraindicated in children. It is not the first line drug for as an antipyretic for the children. Paracetamol এ কি কোথায় ইউজ হবে? Paracetamol fever, and if there is a কি টাইপের পেন, ইনফ্লামেটরি গাউটে ইউজ হবে? কেন হবে না? Why it is not preferred in gout? Because they have a very poor anti-inflammatory action. Clear? গাউটে তাহলে ইউজ হবে কি? অ্যাসপিরিন ইউজ হবে? কেন ইউজ হবে না? Uric acid excretion is not consistent in different dose of aspirin. They can precipitate gout also. তাহলে কি ড্রাগ দেবে? হ্যাঁ, allopurinol is not NSAIDs. Which NSAIDs is preferred? Ibuprofen, ibuprofen, clear? But not two drugs. কি যে দুটো সবচেয়ে কমন? One is paracetamol, as they have no anti-inflammatory action or poor anti-inflammatory action, and one is aspirin. Why? Because uric acid excretion, effect on uric acid excretion is inconsistent over the dose of aspirin. It may lead to precipitation of gout also. Hepatotoxicity can occur due to overdose or toxicity of paracetamol. কি দেওয়া হবে তখন? N-acetylcysteine. How it occurs? deplete the glutathione in the liver and causes hepatic necrosis. To prevent that, we give N-acetylcysteine. So paracetamol is bind with the N-acetylcysteine rather than the glutathione in the liver tissue. That prevent hepatic damage. Clear? তাহলে aspirin হলে salicylism, paracetamol toxicity হলে liver damage. কি দেবে? N-acetylcysteine. আর in case of aspirin toxicity, there is no specific antidote for aspirin. Whereas for paracetamol, there is a specific drug you can use. There is either prevention of absorption, increase excretion and supporting treatment for aspirin toxicity. For paracetamol, there is a specific drug named N-acetylcysteine acts as an antidote. You have to remember this. Aspirin toxicity and paracetamol toxicity. Paracetamol toxicity has a specific antidote, N-acetylcysteine. Aspirin toxicity doesn't have a specific antidote. They have a either supportive treatment, prevention of absorption or increased excretion. Diclofenac used as a very good anti-inflammatory analgesic used in arthritis and injury. Already discussed. Synovial fluid concentration is indication of it is very helpful in osteoarthritis, rheumatoid arthritis and in case of any type of arthritis because its concentration in synovial fluid is very better than other NSAIDs. Used commonly rheumatoid arthritis, osteoarthritis, dental pain. Dental pain, diclofenac is preferred, ankylosing spondylitis and gout. It also used in case of pain management of pain due to gallstone or renal stone. Propionic acid, similar use as a chronic treatment of rheumatoid arthritis, osteoarthritis. Ibuprofen used in all arthritis as well as dysmenorrhea. আরেকটা কি হয় dysmenorrhea commonly used? Mefenamic acid. Mefenamic acid used in dysmenorrhea. Clear? Indomethacin, similar effect, gout, ankylosing spondylitis, rheumatoid arthritis, osteoarthritis. Ketorolac কি বলেছিলাম? আই ড্রপ, অপথ্যালমিক সলিউশন। ঠিক আছে? সিমিলার পাইরক্সিক্যাম, রিউমাটয়েড আর্থারাইটিসে ইউজ হবে, ইন্ডোমেথাসিন, মিফেনেমিক অ্যাসিড। আচ্ছা, সিলেক্টিভ COX-2। সিলেক্টিভ COX-2 এর মধ্যে আবার দুটো they have been already banned. Rofecoxib, valdecoxib, withdrawn due to increased risk of thrombotic disorder like myocardial infarction. Even after it came into the market, post-marketing surveillance shows that they have association with this myocardial infarction. So, though it is theoretically shown that it is protective of GI tract, but it has been shown it is lesser effect or deleterious effect in myocardial infarction. Clear? তাহলে মোটামুটি পুরোটাই কিন্তু অনেক কটা এক্সপ্লেন হয়ে আছে। কি কি? প্লেটলেট অ্যাজ অ্যান্টিপ্লেটলেট, aspirin, anti-inflammatory, where which clinical situation anti-inflammatory dose of aspirin use, different 3 doses of aspirin. Why? That means which drug preferred to block the PDA versus কি কি? হ্যাঁ, কোন ড্রাগ? Indomethacin. Which drug used in dysmenorrhea? Mefenamic acid. Clear? আর কি আছে বলো? আচ্ছা, paracetamol why it is not used in gout? Aspirin why it is not used in gout? ঠিক আছে? আর হচ্ছে টক্সিসিটি, প্যারাসিটামল টক্সিসিটি aspirin toxicity, which has a specific antidote, which NSAID has a ophthalmic preparation, topical ophthalmic ketorolac.